Punishment. Our prisons, called correctional institutions, are supposed to rehabilitate. Our madhouses, called mental hospitals, and supposed to treat. By denying that criminals are punished and mental hospital patients stored, we obscure the nature of both criminal and psychiatric sanctions, undermining the legitimacy of punishing lawbreakers and concealing the illegitimacy of imprisoning persons innocent of lawbreaking. There is much speculation nowadays about whether lawbreakers should be punished or treated. This problem disappears if we define punishment and treatment not in terms of the subject's condition at the end of the intervention, but his intention at the beginning of it. Punishments are interventions which the subject, called criminal, would avoid if he could and submits to by force, whereas treatments are interventions which the subject, called patient, seeks and submits to by choice. Subsequently, the result of either intervention may be judged to be helpful or harmful by the subject himself or by others. However, the outcome of punishment or treatment should not confuse us about whether the process that led to it was coerced or free. There can be only two responses to deviance: repression or tolerance. Those who define deviance and are disturbed by it must either coerce the deviants into conformity or kill them, or must learn to tolerate and live with them. The current liberal psychiatric position on the death penalty is callous hypocrisy, concealed as compassionate reverence for life, except for that of the unborn. Revolted by the anti-death penalty cant prominently featured in the pages of the New York Times, a recently released federal prisoner writes, the death penalty, is much kinder than a sentence of 25 years in prison. Many death row inmates might well choose death in lieu of a mandatory 25-year sentence. Witness the high rate of prison suicide or attempted suicide. Opponents of the death penalty don't really care about the lives or deaths of prisoners. If they did, they would want to give them a choice between a painful life in prison and a painless release from it by death, by means of appropriate drugs put at their disposal by the prison authorities. Crime is illegal behavior. Mental illness is illegitimate behavior. Since illegal behavior is, by definition, illegitimate, it is not surprising that crime is increasingly viewed as mental illness and that psychiatric sanctions increasingly replace criminal penalties.